Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Americans pay more for prescription drugs than any other country in the world, and according to experts, drug costs will only continue to rise in the coming years. So what can you do to reduce your prescription costs? Today we'll talk about prescription drug costs and how you can become an advocate for yourself when it comes to your prescriptions. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Don't go away. We'll be right back. Welcome back. Joining us now is our first guest, Mark Eichler, who is Mountain Pacific's Director of Pharmacy Services. Mark has more than 30 years of pharmacy experience. Thanks for joining us today, Mark.
Thanks, Lisa. It's good to be here.
Great. So can you start out by telling us what a formulary is and why health insurers have these?
Sure. A formulary is simply a listing of medications that your insurer will cover for you. They can be a listing of generic medications, brand name medications, or specialty medications that you may be taking that you get from a specialty pharmacy. It'll also tell you what your coverage restrictions are with that formulary. It'll tell you what your co-insurance or co-pay is for that formulary. And it's a way for insurers and health plans to direct consumers to lowest net cost drugs that maintain the same clinical and benefit as any one of the tiers. And we'll probably talk about the tiering of medications in a minute. You
bet. So interesting. Who chooses the drugs on a formulary then? Are these randomly chosen, or is there some science behind that?
Yes, there is a science behind that. Most people don't understand that, but there is some significant amount of effort that goes behind choosing drugs on the formulary. Typically, health insurers or health plans will engage a pharmacy and therapeutics committee. That P&T committee will be comprised of pharmacists and physicians that help evaluate new drugs as well as older drugs on safety and efficacy, and then place them in tiers along the formulary. And they'll also do an evaluation of the cost structures of the medications to again place those in the tiers that we'll probably talk about here shortly.
Absolutely. So if someone has a copy of their formulary and they see that a certain drug requires a prior authorization, what does that mean?
A prior authorization is simply a tool that health plans and insurers will use, and it's mainly a process to limit or restrict certain medications for use, and we'll probably talk about some other things in a little bit, but prior authorization can be done electronically, it can be done by fax, it can be done by a telephone, but it's simply just a process that a health insurer will use to cover medications appropriately for their members.
So why do health insurers have these prior authorizations, and what's the whole point behind that? Sure.
Prior authorization is an important utilization management tool used by health plans and insurers to ensure that medications are used properly, as well as certain medications have safety issues. For example, there might be high chances for inappropriate use if not authorized in a specific manner. So that's why health insurers and health plans have prior authorization procedures.
So a term that our viewers may not be familiar with is step therapy. Can you talk a little bit about what step therapy is?
Sure, Lisa. Step therapy is simply a part of that prior authorization process where the insurer or health plan will require you as a user to step through certain therapies before you can get to certain other higher cost therapies, for example. Because there's a lot of medications on the market that don't provide really any more value than a generic medication, for example. So they might step you through a generic before they allow you to have a brand name, or places in therapy. For example, some drugs are third line therapies, so a health insurer may require you to use a first line or a second line agent before you can use a third line agent, and that's what that step therapy is all about.
So can that save folks money? In fact, step therapy, can that actually help save consumers' dollars.
Absolutely. For example, if the step therapy is requiring you to use a generic before a brand, that will always save the consumer money because your copay for the generic will be less. It'll also save your company if you're employed by a company that is a self-funded company, for example, and pays their own bills. Of course, the company will pay less in drug costs over that. There should not be any decrease in efficacy or because of that step therapies.
Okay. So let's say somebody is in that step therapy process. They're trying a medicine that they're needing to, utilize before they go on to something else, and they end up having a side effect, or the medicine just doesn't seem to be working. What should they do?
Sure. The intent of step therapy is certainly not to impede or lock you into particular drugs. The intent is to save money for the plan as well as the insurer, but also provide the same clinical benefit. If you, as a user of a step therapy program, find that drug that you happen to be stepped to does not provide the clinical benefit that you and your physician wanted, or you're having some adverse drug events from that or side effects from that, that's when you inform your physician or your provider, mid-level or other, about what you're experiencing with that first line therapy, and then that you and your provider then can make decisions about going on from there.
Excellent. So you mentioned tiers a little bit earlier, and I wanted to talk a little bit more about why formularies have tiers and what is the difference with each. Maybe, in 30 seconds or so, if you would be able to kind of explain that.
Sure. Drugs are covered on tiers, and it's a way for health insurers to have rank drugs by efficacy and safety, as well as cost. So, for example, a tier 1 medication may be a generic medication with the lowest cost share to you as the employee or the insured. Tier 2 medications might be a brand medication to provide good value and good clinical efficacy. A tier 3 medication might be one that is a non-preferred brand, for example. There might be generic options for that, or there might be other brands that are cheaper or actually provide better value to you as the consumer and to the health plan.
Okay, great. Stay tuned to learn more about formularies and how you can be an active player in your healthcare, especially when it comes to your prescriptions. We'll be right back. We're back with Mark Eichler, continuing our discussion about prescription drug formularies. Now we're going to talk about common terms in formularies and prescription drugs overall. First off, Mark, though, I just wanted to ask, can formularies change?
Yes, Lisa, formularies can change, but on a limited basis over the course of a plan year. For example, if a new drug comes out on the market, or a new formulation of that drug or any drug might come out, they have to be added to the formulary, so that can occur throughout the year. Most drugs, however, that are established on the formulary at the beginning of the plan year tend not to change formulary status over that time period, unless there's maybe a new generic option, for example, for a brand name drug in the middle of the year, the formulary may change. Most plans offer at least a 60-day notice of any negative formulary change, and Medicare Part D plans are actually required to do that. So if there is a change in that formulary, so if you're on a particular medication and the formulary tier status might change, or it becomes non-preferred for some reason, or has some step therapy or prior authorization procedures, you're required to be notified within 60 days of that formulary change.
Okay, can you tell us a little bit about quantity limits? When folks see quantity limits on a formulary, what's the purpose of that?
Quantity limits are a way for your health plan or your insurer to ensure appropriate use of certain medications. Some health plans or insurers will only allow a 30-day supply of medications to be dispensed. Some plans will allow you to get a 90-day supply of your medication at either a mail facility or at a local pharmacy. That's up to the health plan. Exceptions can always be made to that, but there are also some particular drugs that it's not always good to have a 90-day supply of, for example, an opioid or a narcotic medication dispensed to any patient.
So speaking about a 90-day supply of medicines, can you talk a little bit about whether or not it would be more beneficial for folks to get a 90-day supply versus a 30-day supply from a cost perspective?
That's always a great question, and it's one you should always have a good conversation with your pharmacist about. Some plans allow, like I just mentioned, a 90-day supply either at a retail store. You can just walk in and pick up a 90-day supply. Some plans do not allow that. They want you to go to a mail facility. So there are ways that you as a consumer of that do save money. Typically your insurer or health plan may only charge you 2 copays for a 90-day supply rather than 3 copays if you got 3 individual 30-day supplies. So there is some cost savings to you. There's also some cost savings to your planner and insurer as well, or your employer.
Something that comes to mind with that is weather. So for example, if somebody were to go ahead and use a mail order pharmacy, can weather impact drugs if it's too cold or too warm and you're getting something via the mail?
That's an especially good question now, this time of year in the wintertime. We're always worried, or even the summertime when the temperature's soar. But typically mail order pharmacies, that's their business. They know how to do that. So I personally don't have a lot of concerns about medications being shipped through the mail in times of temperature extremes, for example. There are some instances, however, when if you're going to be on vacation, you might not be home, etc. So if the delivery gets put in your mailbox at home and you don't get to it for 2 or 3 days, that mailbox may be freezing or it may be real hot. So you need to let the people that are mailing that prescription to you know about that, so that you can be home when you need to accept delivery.
Sure. Preferred pharmacy is another term that comes to mind in terms of formularies. What does that mean?
A preferred pharmacy is simply a network that's of pharmacies, just like a network of physicians or a network of hospitals that your health plan or your insurer has, that the health plan or insurer has negotiated pricing for medications. And then some plans actually close access to certain preferred pharmacies. That's simply all it is. It's just a network of pharmacies that your health plan or insurer has chosen for you to have access to.
As pharmacists, we often get asked, are prices going to be different from one pharmacy to another? Can you touch on that a little bit?
That's a great question. It's kind of a loaded question in the fact that it's the drug distribution system and in this country is kind of complex. We have multiple ways for that drug from the manufacturer to get to you as the consumer. And so there are times when drug pricing is difficult. You might show up at one pharmacy. For example, if you were uninsured and were paying cash, the price at one pharmacy might be different than the price at another pharmacy. If you're insured, typically that copay or co-insurance that you're required to pay is generally the same no matter where you go. But if you're uninsured or using a cash price, it's important to always ask the pharmacist about what that might be, because in some cases, even if you are insured, you can ask about a cash price that might be less than your actual copay.
Great. So folks should ask questions to make sure that they're on the right track with pricing.
Absolutely, that's the key.
Yes. All right. Well, great. Thank you. We're going to be continuing on here in a couple of minutes. Thank you for sharing that. Up next, we're going to talk about some money-saving programs and how talking with your prescriber and pharmacist could be good for your wallet. Stay tuned. Welcome back to Healthy Living for Life. We've been discussing formularies and prescription drugs with Mark Eichler. So let's talk about how a person can work with their doctor to find more affordable prescription drugs. Mark, should a person bring a copy of their formulary with them when they go to visit their doc?
Lisa, that's an outstanding idea. I wish more people would actually do that, because that's physicians treat patients maybe with 30 or 40 different formularies in any given day. So it's really critical that if especially if you're a new patient or you're expecting a new medication to be prescribed for you, bring a copy of your formulary. Even if you don't understand it, your physician probably will and be able to help you with that.
Excellent. So communicating with your doctor about alternative prescriptions could be beneficial for you, right?
Absolutely so.
Okay. So what if you go to your doctor's office and they don't have time to review a formulary? We know they're busy, they're seeing a lot of patients, and that's just the way it is. What can you do as a patient?
Well, first of all, as a patient, I would hope that would perhaps never happen, that my physician, I would hope, have at least a few minutes to talk to me about my drug therapy, because it's such a critical component of how my physician might treat me. So, but given that fact, you might at least engage your physician and say, oh, if you don't have time today, I understand that. Is there a way that we can communicate via either email, or can I call you back some other time after hours, whenever, I understand you might have a busy schedule today, but I really need to engage you about my drug therapy and what might be best for me, or give me a way to save money based upon my formulary options.
Being an engaged consumer, that's important. So another question that comes to mind, can your pharmacist help maybe choose an alternative medication when you go to your pharmacy to fill your prescription, right at that point of fill? How does a pharmacist weigh into that? Are they able to assist with that?
Absolutely so, and perhaps even more so than a physician at times, because they fill prescriptions for all kinds of people. They fill prescriptions for various formularies every day. So they may be a little more in tune to that particular formulary. They can inform you about cash prices, what your copays are going to be, whether if you paid cash outside of your prescription coverage, whether you might save money. Absolutely, the pharmacist is who you really, really need to engage in that process. They can help save you money, as well as provide very clinical, in-depth support for you.
They might even be able to communicate with your physician about that too, if
Absolutely.
Time permits.
Yes. Yeah, they can be your conduit to that physician.
Yes, good. So I know that some drug companies have drug coupons. In fact, I just saw an ad last night on the television. Of course, there's always, get a hold of us for assistance. Some are given out by doctors' offices and available online. So can you talk a little bit about if somebody starts with a drug coupon and they use it for a few months and then they find out down the line their prescriptions are going to be more expensive, for example? What's going on? What advice would you give folks?
That's a really pertinent topic these days, with the prices of medications being so high, either copays being high, or if you were uninsured, just the sheer price of the medication. So manufacturers' coupons are a way for manufacturers to discount or provide you the medication either at no cost or low cost. It's a way for them to get you on medication, for example, or if it's a brand medication that might not be covered by your formulary, there's ways to do that. Coupons can be a little misleading or a little deceiving at times, because they might cover you or lower your copay, or in some instances have no copay for a limited period of time, but after that time period is up, you may be forced with the full price of that medication that's now no longer covered by your formulary. So it's really important to ask your pharmacist about how that coupon works and what the ramifications are and the time limits that might be associated with it.
And there really might be something less expensive that is appropriate to use after that time.
Absolutely. I mean, how many ads have you seen on TV for new medications that you might become enamored with? You want to get that medication, you ended up showing at the pharmacy with that coupon for a free supply of drug. Well, you didn't know that medication might cost you $200 to $300 in the end.
Yes, absolutely.
Absence of a coupon.
So a lot of times brand name medicines have a generic available. Are generic medicines always less expensive than the brand names?
In general, they are, but there are instances when the generic medication may not be, and there's some reasons for that. Sometimes when a brand name medication becomes generic, manufacturers will have an agreement with the generic company, and they will authorize a generic company to make the generic and give them 6 months of exclusivity. In that 6-month exclusivity period, the difference in price between the brand and the generic may only be 10 to 15%. So especially on new entries into the marketplace, that may not occur. As well as some formularies, because of rebate situations with the manufacturer to the health plan or insurer, may actually prefer a brand over a generic, so it may be cheaper for you as the consumer to actually use the brand because your copay might be lower because the brand is preferred over the generic.
Okay. Can you talk about sticking with one pharmacy? Is that a good idea to fill all of your prescriptions at one pharmacy?
Absolutely. In my opinion, it's critical to use one pharmacy if you can. There's all kinds of reasons why people choose their pharmacy: cost, convenience, but those are societal norms about we always want to get things the cheapest we can, and we always want to get them the quickest we can. But in some cases with your health, and especially your prescription health, that's not always the best idea. A pharmacy has your complete drug history and picture. They know you, they talk with you, so it really is a good idea whenever possible to use one pharmacy and choose that pharmacy wisely.
Excellent. Just in a few sentences, can you hit on drug discount cards?
Sure. Much like the coupon, a drug discount card uses very similar mechanisms. Sometimes, if for the uninsured, for example, a drug discount card may offer an opportunity to get a medication at a lower cost. Again, it's real critical to have your pharmacy perhaps run that discount card against a prescription so you know exactly what you're going to pay before you actually pay for it, because if you leave the pharmacy and actually pay for it, you can't return that medication.
Good, excellent information, Mark. Thank you so much for being here today. I want to thank you for tuning in today as well. I hope you found our show helpful. Until next week, stay fit, stay well, and stay healthy with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.